teach you how to care for a patient with a disposable inner cannula. This procedure will also include tracheostomy, suctioning, and trach care. I will first like to describe the different supplies that you will need to gather for this procedure. First, please gather a towel to place over your client just to prevent soiling. Then you will need a suctioning catheter. And how we like to explain this is that the French of catheter that you need needs to be less than half the diameter of the inner cannula. There is also an equation that you can refer to the PowerPoint for. This catheter kit also includes one sterile glove and a sterile basin for your normal saline. We also have provided, just for your demonstrational aid so that you understand what a disposable inner cannula, the actual inner cannula, and the trach tube looks like. Additionally, for this procedure, you are going to need a new sterile disposable inner cannula, and this will be used during the second portion of this procedure. Also, the smaller trach kit will be used for this procedure, and this will be used for stoma site care. This will include 4x4 split gauze as well as other necessary components. Because you're using the smaller kit, you will also need sterile saline. Please also remember to have hand hygiene supplies at the bedside, as well as the second set of sterile gloves, just in case your first set becomes sterile, or unsterile, excuse me. Also, in your room, you will find other necessary supplies, which include a suction chamber, a suction tubing, then also oxygen supplies, because your patient may have a trach collar or other oxygen, and you will also have an ambu bag. We recommend using a pediatric ambu bag if the patient requires extra breaths. And now we will begin the next procedure. Now we are ready to assess the patient. First, you will identify your patient. And please remember that a patient with a tracheostomy may be verbal or nonverbal. Depending on their means of communication, you can identify them using their armband against their medical record number that you will find in your chart, or you can have them write their name down for you or simply nod their head by saying, "Are you Mr. Smith?" And they can nod their head. Then you want to complete an assessment similar to the other procedure. The first assessment that you will do is get the oximeter and use the oximeter to get your pulse ox. You want this above 92%. It is recommended to always hyperoxygenate the patient. And we want to do that because when you're suctioning, you're actually removing oxygen at the same time. The different ways that we can do that are hyperoxygenate if they, for some reason, are actually on a ventilator. There is a hyperoxygenate button that you can use. If the patient is not on a ventilator but has a trach collar on, you can also hit the increase the number of liters per minute and have them take a few deep breaths, 2 to 3, to increase their oxygen saturation. The other option is to use the ambu bag, the pediatric ambu bag, and give 2 to 3 breaths. Then you are ready to further assess your patient by listening to their anterior and posterior lung sounds. The information from your assessment can then be used to determine if the patient needs suctioning. In this case, Mr. Smith does need suction, and so that will be the next procedure. I will begin by placing the towel over Mr. Smith's chest just to protect him from any additional secretions. Now that you have assessed your patient, you will don clean gloves. And the purpose for donning clean gloves is to remove the tracheostomy care dressing, and this is soiled. And at this time, you can also assess the stoma site for any additional drainage, redness, or irritation. You will then dispose of properly in the trash can. Now wash your hands. Now you are beginning a sterile procedure. So watch closely what I do with each of my hands to maintain sterility. I will first open the package on the table, always opening away from your body. Then remove the sterile basin. And it is best to touch only the bottom 1-inch border, 1/2 inch border, and place on the edge of the bedside table. Close enough so that when it's hooked up to suction, you can access it. Next, you will pour normal saline into the sterile basin. Make sure not to cross your sterile field. And the purpose of the sterile water is to make sure that your suctioning is working properly and clear secretions from the tubing. You can now don your non-sterile glove on your non-dominant hand. With your right hand that is sterile, you can pick up on only touching the outer paper and place it on the outside of the sterile field, and then you can don your dominant hand with your sterile glove. Now, using your non-sterile hand, you can pick up the paper, and using your sterile hand, you can withdraw the catheter, which is sterile, and maintain sterility. You can dispose of the paper. You will then, with your sterile hand, hold your suction catheter, and with your non-sterile hand, connect it to the suction tubing. Hold in your sterile hand the suction catheter. Then you want to turn on your suction up to no more than 120 mmHg to maintain proper oxygenation and not to provide too much suction in the airway. You can now use your non-dominant hand on the suction tubing and uncoil the suctioning catheter, and you will test your suctioning by applying intermittent suction on the valve, and you will hear the saline going up into the tube. Now it is time to suction the patient. Now please remember that you do not want to insert the catheter more than the length of the actual inner cannula, and the inner cannula must be in when you suction. When doing this, you want to apply intermittent suction, which implies that you close off the valve and then remove your thumb, and you do not want to apply suction as you insert the catheter. So I've already hyperoxygenated my patient, and now I will insert the catheter. And while removing, no more than 10 to 15 seconds, I will apply suction. Rotating the catheter. I will then apply suction and clean out my catheter. This also adds as a lubricant. If the patient requires a second pass of suctioning, you can wait 30 seconds while hyperoxygenating the patient and then complete the procedure. So I have waited 30 seconds and I have hyperoxygenated my patient again. And I will have identified that the patient still has necessary secretions that need removed. And I will insert the catheter, not applying suction, and rotate the suction catheter and pull out while applying intermittent suction. This procedure is now complete because the patient is not showing any signs of respiratory distress or buildups of secretions. Now we are ready to complete stoma care. During the first procedure, we had already removed the soiled dressing, and so now you are ready to set up your sterile field. If you have not already washed your hands, you will wash your hands. I'm going to open up my smaller sterile basin away from my body. There is a sterile drape in this package, which should unfold. The shiny side will be kept down against your bedside table. And this is your sterile field touching only the half outer inch border. I can resituate this basin by touching the outside. Now I will open my new disposable inner cannula, which we demonstrated at the beginning. And you will open this slowly so as not to flick it anywhere, and you will dump it onto your sterile field. I will now don clean gloves and remove the inner cannula. If the patient appears, or if you have assessed and the patient's oxygen saturation is lower than 92%, you may use clinical judgment to hyperoxygenate the patient. So I will now remove the inner cannula using a rotating motion and dispose. I will now wash my hands and don sterile gloves. As you might remember from the initial procedure, this can be seen as, the stoma care can be seen as a clean technique, but when inserting the new disposable inner cannula, it must be sterile, and that is why this procedure requires sterile gloves. So you now quickly pick up the clean, new disposable inner cannula and reinsert using counterclockwise motion until it clicks into place and reapply oxygen. You can now begin stoma care. Because we are using a basin that does not already have normal saline, you will now need to pour the normal saline in. You have a couple of options because this is now a clean technique. You can pull out your supplies and spread them out onto your sterile field. You will not need the trach ties. You can then open the normal saline and pour it into the basin, about 1/2 inch to 1 inch deep. You do not need as much normal saline because you are simply cleaning around the stoma site. So to begin, you will dip the 4x4 gauze into the saline, squeeze out and clean around the stoma site, cleaning from clean to dirty, and then you will dispose. You will do this until the site is free of drainage. We also recommend keeping one 4x4 piece of gauze to wipe excess saline off of the patient's neck and from around the stoma site. You can also use the cotton tip applicators to clean more closely to the stoma site, which you will dip with saline in one pass, only one pass, because then it is soiled. And now that the site is clean and free of secretions, you can now replace the 4x4 slate gauze. And this is to protect the patient's neck from additional secretions. Now that you have completed this procedure, you can remove your sterile gloves and wash your hands and dispose of the supplies as needed. Please also remember to provide correct documentation according to your facility